Good evening, everyone. It's nice to be back after a gap. And I apologize for that absence, but as some of you know, or as many of you know, I hope, I was unfortunately hospitalized with pneumonia. I'm back now, but as you can see from the sound of my sore throat, still not fully back. But as they say, the show must go on. I'm Barkha Dutt, you're with the Mojo story. And our focus today is on the unfolding catastrophe in China. A surge that could, according to leading global experts, see 60% of China infected in the next 90 days and up to an estimated 1 million deaths. This has global implications. Remember, this is how the pandemic started in 2020 and the failure for China to be transparent with the rest of the world. As protests have erupted, Xi Jinping has abandoned his zero COVID policy. But the substitute has been absolute chaos and free fall, with crematoriums and graveyards piling up and pharmaceuticals running out of medicines. Should the world now be looking to shut down air traffic with China? What does this say about the absence of efficacy of the China made vaccine? And what does it mean for us here in India, where the government has already sounded an alert, asking people to mask up in public, but also asking leaders of the Congress like Rahul Gandhi to consider suspending their Bharat Jodo Yatra, the pan India political journey that Mr. Gandhi is on? The questions today on this broadcast are not political. They are fundamental. They concern every citizen, not just in India, but everywhere in the world. Can the world afford to let China do this to the globe again? What do we know? What do we not know? What should we do? What can we do? Let's introduce three very, very distinguished experts on the program today. Joining us is one of India's best known immunologists, Dr. Vineeta Bal. It's good to see you, ma'am. Welcome to the program. Also joining us from New York today is Jamie Metzl. Jamie first brought the world's attention to the obfuscation in Wuhan at the time of the original leak of the virus from that Wuhan laboratory in 2020. And also joining us is one of the world's foremost epidemiologists, Dr. Eric Fiegl Ding, who first used the phrase thermonuclear bad on his Twitter timeline to jolt the world into waking up and taking notice. And the images that we've seen, including on Eric's timeline, are truly catastrophic. In fact, if we play those pictures, you can see there are people who are piled up in hospitals, beds are running short, there are not enough medicines. There are other images where you see, not enough space at crematoriums. For us in India, it's all too reminiscent in some ways of what we saw in the second wave. But China, as we said, has been experimenting with a so-called zero COVID policy that it's had to abandon. And now it's faced with a reality check that will leave none of us unscathed. So I want to start with you, Eric, if I may. As I said, you were the first one to draw the world's attention to what's happening, and the models you're looking at are in fact dire. You're talking about an estimated 1 million deaths, 60% of China infected in the next 90 days, 10% of the world's population. What does it look like, and why is it so bad, Eric?
Yeah, thanks for having me. What China's going to be facing is basically what the rest faced, the world had faced back in the spring of 2020. The difference is that obviously we have 3 additional years of experience, but China is has still the largest country with virgin fields of uninfected people and vaccinations with the weakest vaccines of all the major vaccines worldwide and under vaccinated in terms of boosting and no bivalent available. And so altogether, it's a perfect storm in which variants are now the most evasive than ever. China's CoronaVac made by Sinovac and Sinopharm are two of the weakest vaccines. Their booster rates are very poor. And altogether, they don't also have monoclonal antibodies or Paxlovid really. And so right now, as they reopen, they're seeing literally the effects of the surge. There is a very clear cause and effect of their relaxing mitigations and seeing all of this. And unfortunately, also China does not use N95 masks like South Korea does, nor do they use airborne transmission protocols and monitor ventilation disinfection like Japan really does. And then I want to point out that South Korea and Japan, their waves were always much smaller than the West. And they never had a true zero COVID lockdowns or anything like that. So you can have a zero COVID approach without lockdowns. They're not synonymous. But
Yeah.
China right now is undergoing a lot. And the chief epidemiologist of China actually said the worst is yet to come. And this is going to be the first of 3 major waves. The second wave starting after the Lunar New Year and in the end of January. So I think China is going to be facing a lot, and they don't have the readiness for it, because you can build more beds, but you're not going to be able to build more doctors and nurses to staff them, especially in such a short time.
Can I draw your attention to the numbers that you shared on your Twitter timeline? You spoke about 60% of China being infected, which would mean 10%. We're looking at 10% of the world's population. But you're talking also, unfortunately, about up to 1 million deaths. Can you speak a little bit about, the numbers sound dire. This is what the models are pointing to. Can you talk a little bit about why it looks so bad, why we're looking at this scale of fatalities possibly?
Yeah, first of all, 60% infected is not that large if you consider that most of the world, most of the Western countries, India, we had well over 60% infected in the previous wave. So like some of the Omicron waves, we had 80% of people infected. So 60% is well within the, likelihood.
Yes, but you're also talking about 1 million deaths.
Yeah, the 1 million deaths, look, we know this will happen because, look, China is, a much larger country. And 1 million deaths, U.S. has already had 1.1, and U.S. is 4 times smaller. So the equivalent is 250,000 deaths in the U.S. So 250,000 death equivalent in the U.S. For China, 1 million deaths is almost nothing. Because if you think about it, like China, if you look at Hong Kong, they reopened in the spring, and Hong Kong had a cataclysmic surge. And if you take that, the Hong Kong's death rate, and extrapolate that to mainland China's population, you can easily get 1 million, if not 2 million deaths. And remember, Hong Kong uses Pfizer, Moderna, Western vaccines. Their variants weren't as evasive back then. And Hong Kong has other drugs and lots of higher doctor and nurses per capita population than mainland China. Mainland China is in much worse shape than Hong Kong once this gets out of control. So I think 1 to 2 million deaths is well within the realm of likelihood. It's not that large considering how large China is. And I remind you, in India during its Delta variant wave, easily 2, 3, 4 million people died according to many epidemiology estimates.
Well, the debate in India continues over the exact number of COVID deaths, ranging from whether the actual number is 4 to 10 times higher than what the official accounts present. But at the moment, Eric, the real question is what this means for the rest of the world. And I want to bring in Jamie, who has done some very sterling research on the obfuscations, Jamie, according to you, that we saw from China in the first wave, the lack of honesty with the world that could have led to a very different outcome for the rest of the world. Now, here's the question. Given China's dodgy track record on being transparent with its data, given the fact that their official counts are still not reflecting the kind of catastrophe that Eric and others have spoken of, should the world be looking at shutting borders, air traffic with China? I ask this even though I'm not a fan of this approach. When this happened with South Africa, I criticized it. But China has a record of an absence of transparency. Jamie, how are you looking at what's happening?
So thank you, Barkha, and I'm happy to be here with you. So let's break that down into the 2 parts of your question. First, what are the implications of China's lies, not just for China, but for the rest of the world? And second, how should we respond? So already in the earliest days of the pandemic, China's lying and obfuscation, including lying to the World Health Organization, lying about what was happening there, not giving the rest of the world the information that we would have needed to respond more aggressively in the early days of the pandemic, which is separate from the other question that we've talked about in the past. How did the pandemic even start in the first place? But that round of lies put the rest of the world at risk. Right now, there is absolutely no doubt that the Chinese government is lying on an industrial scale. Yesterday, they announced that there were 5 and then 7 total deaths. We're all seeing these images of people lined up, cars lined up around the block in crematoria. The numbers, China has stopped recording the spread of COVID inside of China and is just lying again on an industrial scale to the Chinese people and the world. That's not just bad for China, it puts the rest of us at risk. We all need eyes and ears everywhere, because one of the things that the pandemic experience has taught us is that a threat anywhere is a threat everywhere. And so what we're going to see, I certainly agree with Eric that we're going to see these big numbers, and there are going to be lots and lots of deaths, lots and lots of exposures. And because of lots and lots of exposures, there is going to be a lot of variation in and mutation in the virus. And if we don't have eyes and ears on the ground in China letting us know what we're facing, then we are all at risk. And so I'm like you, Barkha, I'm cautious about blanket travel bans, but we need to be looking at everything. And at the same time, what we need to be doing is helping the Chinese people. The Chinese people
Well, they have to be willing. They have to be willing to seek that help, right? China so far has not been willing, for example, to import Western-made vaccines, or even India-made vaccines, dare I say. JB, I'll get to that in a moment, but you had a statement. The Chinese government is lying to its people and therefore to the world on an industrial scale. Can you give the most stark example of this industrial scale lie that you've witnessed perhaps in the last week?
Yeah, well, like I said, they have said there are 7 deaths from COVID. We are looking at the images that you just showed of these bodies lined up. They are saying that, I don't know what the exact number is, but 7,000 infections. That's a lie. Even the idea, the World Health Organization, Mike Ryan announced last week that this explosion was already happening before the protests. So they're having the protests inside of China. So China has already been experiencing exponential growth of infections. And then on top of that, the government, which had before been saying, oh, we need to be worried about COVID, and China is responding with zero COVID better than the rest of the world. Now the Chinese government immediately is saying there's really no threat from COVID. It's mild. Everyone should go to work, even if you have mild symptoms. And what they seem to be doing is using this tool of propaganda in a way to try to propagate the virus, to get through a massive explosion in infections as quickly as possible. And Eric mentioned 1 to 2 million deaths. The Chinese government, the Chinese Communist Party, is in the business of lying about the deaths of the Chinese people. It's estimated that about 47 million people died as a result of Mao's policies, and yet that is swept under the carpet. And what they're going to try to do is sweep this under the carpet, but that puts all of us at risk.
Yeah, and I'm going to come to Vineeta in just a moment. Eric, if you just want to jump in on this point that, how does the world respond when you don't know the truth? Now, all governments across the world have been, charged with undercounting COVID deaths. But this isn't about undercounting. This is about a real and present danger. This is about a real and present danger as it's unfolding in real time, not an ex post facto look back at the number of fatalities. Do you believe China is lying to the world?
Well, I think obviously the single-digit number of deaths China's officially reporting is, of course, laughable. Everyone knows that. Everyone in the ground in Beijing, in major cities, know that. And right now, COVID hasn't even reached a hinterland, medium and smaller cities of China yet, which have even less medical infrastructure than Beijing. Look, like the other day, I had interviews with Chinese colleagues that were all canceled because their entire media team got sick. The famous Chinese opera singers have already died who were just 40 years old. Like, these kind of things don't happen in normal times. Have never happened in normal times. And of course, fever clinics, you can't cover up that they're full. And the cremations, you can't cover up that the cremation backlog where refrigerated trucks are there. So people don't have to. And people know in China know when the government is lying. People realize that, but they realize that they kind of have to, bite their lip and fend for themselves. The issue is, what is the world going to do about it? What is the Chinese government going to do about it? Because if the China reverses course, if they swallow their pride and reverse course and admit they were wrong, that we could actually avoid over 1 million deaths. We could have much less if China decides we're going to take seriously, we're going to import other vaccines. We're going to roll out the bivalent updated vaccines. We're going to roll out the mucosal inhaled vaccines. But, right now, short of them admitting the truth will help them change the direction. Without them admitting them, they're not going to change direction.
That the track record of China doing that through the pandemic has not been stellar. But to understate that fact, let me bring in Dr. Vineeta Bal now. Vineeta, India has sounded an alert. There has been a sort of an emergency meeting. Genome sequencing has been called for of variants. But before I get you to respond, what's very interesting is I looked at the data today on how many Indians are actually getting vaccinated with their third dose. The 7-day average of daily doses in India is at its lowest level since the pandemic, right? Which means that there are very few people who are actually going to get vaccines that are, in fact, available. If you break this down by age groups, you will find that while most adults have, in fact, got 2 doses of the vaccine, if you look at the people between 12 and 18, the average is just 1.3 doses. And finally, and this is the kicker, guess how many million Indians could get a booster but have chosen not to? 719 million Indians. 719 million Indians are yet to get a booster. This is not like the second wave. The vaccines have been available. People have just got, well, either smug or they don't want to hear about the pandemic or they're in denial. And now everybody's in a panic over China. But we still aren't getting the boosters or the precaution doses, we call it in India. Vineeta, how do you look at what's happening in China and how should we and the rest of the world be responding?
In addition to what you said, I agree with you when you presented statistics about vaccination status in India. But what you have completely excluded, possibly because we also don't have data, is 0 to 12 age group. There are some vaccines which are now recommended for not zero, but say 8 to 12 or some such age group, so that younger generation can also be covered and somewhat protected. For that, I have no idea what the data are like, what the numbers are like. So that's an additional chunk of vaccination which is missing from the scene that you described. So yes, vaccination would be useful. I also think that other people have been saying, other countries who are good in epidemiology and serology have been saying that 60%, 70%, 80% positivity after the Omicron. So whatever earlier wave followed by Omicron, so in total infected people were close to 80% in some situations. We have data on some metros, some small data on here and there, but we are also a very big country. I mean, like China. So we don't have good data. How many of us were actually infected with Omicron? We have no idea, because also the major lacuna right now is that if we assume that China is going to be the source of spreading one subgroup, second subgroup, one variant, second variant, I don't know what, because I haven't come across real sequences of which virus variant is currently prevalent in China. If we know that, and if it is closer to Omicron, and if, I know I'm adding many ifs, and if the at least 60% of the Indian population, young and old, vulnerable, non-vulnerable, are or were infected by Omicron, then we might not have so much of risk, because Omicron was just less than a year away. So December, January was when Omicron hit India very badly, and it has been continuing to some extent. So in that sense, the risk is less. not because possibly we have good coverage of vaccine, because you also have to remember that the vaccine that we have had is the Wuhan strain, and Omicron infection is actually, so infection with Omicron and whatever minor consequences are not really covered by the original Wuhan strain, though now there are some vaccines which might become available.
Right.
So there are too many ifs and buts even in the Indian scenario,
So,
where we
so, so
need
in
to be
other
worried
words,
about.
in other words, we are entering another period of uncertainty with a lot that is not known. Eric, one of the comments that you made that really stayed with me is that you think that China is basically going to let as many people die if they have to, get sick if they have to. They basically, in effect, wash their hands of this growing catastrophe. Can we unmute Eric, please?
Because China right now is not reversing course. It, does, it doesn't seem like they're gonna, release and then mitigate back down. Because I think in many ways they want to, get it over, kind of like many Western countries. But and also, it just came out that China will now officially only report direct respiratory failure deaths as COVID deaths. That was just reported. And I think, of course, that's another way of saying a euphemism. We're going to cover up the total
So
number.
are you expecting a massive China cover up, Eric?
Well, I think they're going to try to play with the numbers in many ways. Remember how there are many people who die of other things during the pandemic. So when hospitals are full, there's many other people who need surgeries and other diseases who are due to the hospital being full, they die at home. And also there's other heart attacks and strokes that happen, weeks after a COVID. And we're not even talking about true long COVID yet, that they're going to try to undercount. Because, Omicron in many ways, it has this insidious effect. Also, it's also more severe in kids. And in kids, is sometimes if you don't do testing, you don't know what people are sick from. And similarly, if you don't do the testing, no pandemic, right? So I think they're going to find ways in which to undercount. But I think this is why excess mortality, which the WHO Mortality Committee uses, is probably a better metric in the end. And estimating cremations is probably another good metric of the actual death as well. But I don't think China is going to be very transparent. And they just admitted that they're going to narrowly define COVID deaths. It's very worrisome.
Jamie, should the world be closing borders?
So I don't think we should right now close borders, but I think we should demand a level of transparency as a condition for not taking much more aggressive steps. This is in many ways a political pandemic in China. China, we have to give them some credit for the early phase of zero COVID, which probably saved lives. But just like New Zealand transitioned off of zero COVID, once better vaccines were available, China couldn't do that, primarily, in my view, because Xi Jinping was angling for his third term because of nationalism, because their vaccines weren't that great. And now we're all facing the consequence. What the pandemic has shown us, as I mentioned before, is our world is interconnected and we're all interdependent. And if China is going to lie and obfuscate and cover up, we can't have the levels of integration that we've had in the past. That is too great of a risk for the rest of us. So I think we have
so
to.
What should be the ask before the world takes a decision on sealing borders?
I think we should ask first for a level of transparency and accountability. We need a level of visibility.
I mean, who's going to ask for this?
I think the World Health Organization can be the lead organization, and there needs to be a level of surveillance. As was just said a moment ago, we need to know how is the virus mutating inside of China, if there are dangerous mutations. And we only learn about them when they explode out of China. That's too big of a risk for everyone else. So I think what we need to do is the rest of the world come together and say, look, these are our conditions. We're all dependent on our trade with China, whether we like it or not. We have a lot of interactions with China. We've been globalizing our economy for decades now. But that can't be a limitless experience. So I think that the World Health Organization, leading groups of countries, India has an essential role to play in that process, need to come together and say, look, here is what we need. If we can get it, we will work together. The United States government has made clear that the Western mRNA vaccines can be easily made available to China. Eric talked about steps the Chinese government could take now that it's not taking for political reasons. We're all connected. If China isn't doing its part to protect the world, then we need to take steps to protect ourselves.
I'm not optimistic that China is going to respond in the way that you and Eric are hoping. And Vineeta, that takes me to, in a way, the elephant in the room. Has the China-made vaccine failed, or is it that it was administered at such an early stage of the pandemic without any exposure, like many of us have had in India, which is called hybrid immunity, some from the vaccine, some from exposure? That's the real problem. What is it? Does China need a new vaccine? And if it does, can we really expect someone as draconian, dictatorial, proud as Xi Jinping to get off his high horse and ask the world for help?
Multiple questions. So,
Yes.
first thing is, yes, the other killed vaccines, which be similar to what China had produced earlier, haven't proven uniformly useful. So, their efficacy has been less as compared to either the adeno-based or mRNA-based vaccine. So, that's a generalization. So, one assumes, again, the early trial data was available. I think it was on about Sinopharm, but not really extensive data as it is for many other vaccines. So one assumes that the efficacy of the vaccines which were used in China, which were primarily killed virus vaccines, is likely to be low. On top of it, as you said, that the vaccines were given much earlier. Now, I mean, the onset of pandemic was Jan 2020, and we are close to Jan 23. So it is 3 years, close to 3 years. So more than 2 years ago, possibly the vaccination was done. Also, one has to remember that it was for Wuhan strain. And all I'm trying to say is currently, which is the variant of virus which is invading and which is there in China, whether it is a local mutant which is similar to Omicron or alpha, beta, gamma, delta, whatever else that we had, we have no idea. So the chances are that the old vaccinees may not have as much protection if there is no hybrid immunity. And especially the reports I had read said that the elderly in China were absolutely spared from vaccination. Maybe younger people were given vaccination because they needed to go to work or whatever else the logic was. In which case, elderly who will be more vulnerable are likely to fall sick even more and possibly have more morbidity and mortality both because they are vulnerable apart from other population also equally vulnerable. So I think the situation is quite grave because of opaque nature, the
Yeah.
lack of transparency that other two colleagues of mine here are also highlighting. And
Yeah.
only thing we can do is not block the international borders, but even in India, I think we should be extremely careful. We still have systems in place, though they are lackadaisical because the wave had pretty much disappeared, all our restrictions were removed. But airport based testing and also testing in other parts of the country, that should continue, in addition to keeping an eye as to what is it, which virus, which variant of the virus is getting out of China, because it will get out of China in one way or the other. As I mean,
Yeah.
there is transport, there are various ways in which it will get out. So if we are watchful, then only one can think of again increasing the infrastructure which we had increased
Right.
somewhat in somewhat delayed fashion at the beginning of COVID. Now the process should be faster, and
Let
we are better immune than we were in certainly in January 20. So all of that means that outcome for India is likely to be definitely much better than what the China will go through.
but of course, but at the same time, as Jamie, you said, and let me just get last comments from Jamie and Eric. Now the world is now interconnected. And it's quite simple, the math. The more number of infections, the more the chances there is of the virus mutating and developing a new strain for which the vaccine may not offer protection. It's just as simple as that. You don't even have to anymore be a doctor or an expert like the three guests on this program to know this. But the problem is the opacity of China. Unlike every other country, China is literally the Iron Curtain. And when Eric says China may just choose to let its people die without ever admitting those deaths, I'm not sanguine like you that the WHO will step in. It didn't the first time around either. Jamie?
Yeah, China
Okay.
very
I'll take that to Jamie and then give Eric the last
Yeah,
word.
yeah.
Jamie, go ahead. Yeah.
So we can't be sanguine about anything. Our global systems have in many ways failed, especially in the early days of the pandemic. We had a hard time. The Director General of the World Health Organization, President Trump, the President of the United States, were in this position where they felt they had to placate China by saying nice things in the early days of the pandemic. Both the WHO and the United States government, and frankly, every other government in the world has recognized that that approach hasn't worked. And so we need to be honest about China and with China. We need to recognize that in many ways, these decades of economics-led globalization have in many ways failed. And it's correct to put the images of Putin and Xi, and both of them are manifestations of this failure. And so we need a bit of a reset. And part of that reset must involve speaking honestly about threats. And the world needs to make clear that China has two paths. If China wants to be honest, wants to be a more responsible global citizen, and even if it doesn't, we need to do everything we can to help the people of China, who are more victims of their government than even the rest of us are. So if China's government is willing to buy these effective Western mRNA vaccines, we should be airlifting them to China as quickly as possible. Everybody wants to help the Chinese people, but the Chinese government has a choice. They can follow the path of Putin, of just saying, well, to whatever, I don't know what you're allowed to say on Indian
To
YouTube.
hell with it.
To heck, to hell with
it.
the rest of the
To heck,
world,
yeah.
because our domestic political needs are more important than anything else. Or they can say that we have a world in crisis, and the people of China, we're seeing from the images that you've shown, those are the people who are suffering. If the Chinese government wants to help them, we should do everything we can to help. But if the Chinese government continues with this lying that puts their population at risk and our populations at risk, we need to say, how do we protect ourselves? That's a worse world in many ways, but the Chinese government has a big decision to make. And I hope that they have the capacity to step forward, but I fear they may not.
Let me quickly give Eric the last word. Eric, what is worrying you the most as you track what's happening inside China, with the obvious sort of caveat that what happens inside China will not remain only inside China?
Yeah, I think I completely agree with Jamie, what he said. I think China is a little bit different from Russia because in certain ways, China has a social contract that, as dictatorial as the government is, it has to help its people, feed its people, make sure its people are healthy. There is a social contract there. And if this wave undermines the trust in the government around that social contract to protect the people, I actually think that could actually be the biggest motivator for China to change. So I do hold some hope that China will actually change course when they realize the damage it's doing to the population and, of course, its economy. Because I think the ripple effects are not just, people have to remember China is the factory floor of the world. And just like India, China manufactures so much in terms of medicines, in terms of the exports to Europe and the US. And right now there's a global shortage of fever medications that even China is suffering. Like China has sold out of many fever medications. And if China sold out of these fever medications, the rest of the world's supply chain will be soon disrupted too if this wave keeps rolling on and on and on. So I think people in the West shouldn't have some people have taken a schadenfreude in terms of like this, dreadful glee at China's failure. But I think they should really look upon themselves that if China fails, the rest of the world will suffer as well. And so we should not be gleeful in that. I think saving lives and ending the pandemic sooner will benefit everyone in this world. And that's why hopefully China will see the light and will hopefully roll out their own bivalent updated vaccines and take more measures in terms of N95 masks and air disinfection ventilation for this airborne virus. But we will have to see. The next 3 months are going to be very, very difficult politically and in terms of public health in China.
And for the rest of the world, that is going to have to take some tough decisions on how best to protect their own populations, given the interconnectedness, not just of the world, but of China to markets globally, to the movement of goods and produce, not just of people. Instructive for those who declare the pandemic over 3 years after the pandemic first erupted from that laboratory in Wuhan. We are having the same conversation all over again, just the worst sort of deja vu. I very much hope that Eric and Jamie's optimism about China, I don't know if it's optimism, cautious optimism, hopeful optimism, proves to be true, because otherwise these 3 months are critical, not just for China, but for all of us, no matter where you are in the world. Eric, Jamie, Vineeta, pleasure as always. Thank you so much. And to our audience, remember, 719 million Indians are yet to get a booster. You might be one of them. Think over that. Thank you for watching. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.